Hi, welcome to our module. This is Learning Module 2 of 3. My name is Carrie Wabanascom, and I worked on this project with Wendy Haight, David Gleesner, Priscilla Day, Brenda Bussey, and Karen Nichols. Module 2 will cover the research questions, method, and procedures. In this paper, we report ethnographic research with the Center for Regional and Tribal Child Welfare Studies at the University of Minnesota-Duluth Department of Social Work. We consider the center as a model of culturally responsive child welfare, that is, practice and policy that are comprehensive, sustainable, and effective in particular communities. We specifically explore ways to reduce persistent disparities in the involvement of Indigenous families in public child welfare systems. The center addresses this issue through educating Indigenous and non-Indigenous MSW students and practicing professionals who will create policy, administer programs, and implement child welfare practice. At the center, Indigenous scholars and social workers, tribal leaders, and their allies have worked together for over a decade to design a model of honoring and integrating Indigenous worldviews and Western social work. Indigenous worldviews broadly encompass spirituality and knowledge systems as expressed through language, ceremony, and other traditions and everyday practices. They suffuse the professional education of MSW students and continuing education of child welfare professionals. This model also eliminates the blind spots in Western-centered social work educational models and practices, as well as child welfare systems. It promises to provide understanding for social work generally and child welfare specifically that will contribute to effective practice and policy within our diverse communities and create collaborations to reduce system barriers to equitable practice. The center was created in 2005. It evolved from various projects and collaborations of the UMD social work faculty and tribal communities dating from the 1990s. The purpose was to increase capacity of tribes in the areas of child and social welfare and teach Indigenous culture, language, and history. The center currently administers Title IV-E child welfare stipends, educates future and current child welfare professionals, and engages in community and tribal outreach efforts. Through their work, center staff identifies and addresses system barriers to culturally responsive practice with Indigenous families and communities. Over the years, staff have developed extensive collaborations at the tribal, county, state, and national levels. They have collaborated with universities and states across the U.S. and Canada to strengthen work within and alongside Indigenous communities. Center funding has included major grants from the U.S. Department of Health and Human Services, the State of Minnesota Department of Human Services, the Bush Foundation, and Casey Family Programs to research and improve child welfare practices with Indigenous families. Throughout its history, the center has been committed to diversifying the child welfare workforce by creating an educational pathway for Indigenous social work students and to strengthening the cultural understandings of non-Indigenous students and professionals. In this ethnography, we focus on the center's approach to educating the next generation of child welfare workers and of practicing child welfare professionals. The goals of our research was to start cross-cultural conversations that allow us to reflect back on how we engage students, colleagues, and clients. We also wanted to stimulate creative thinking around aspects of the center's worldview and implications for increasing diversity in classes and educational workshops, and in general MSW programs. We also wanted to recognize and honor the worldviews of the local tribal communities, specifically the Anishinaabe community's worldview, history, practices of the Indigenous families in northern Minnesota. And we also wanted to demonstrate there are better ways to support and partner with Indigenous families and communities. These do not provide a roadmap to Indigenous child welfare scholarship, practice, or education. Rather, this is just a great example of how we can work better and do better with Indigenous communities and families within the realm of social work education and social work practice and policy. This paper is the first in a series of 3 papers emerging from the ethnographic study of the Center. The specific research questions addressed in this paper are: what is the Center's underlying educational worldview? How is this educational worldview put into practice? Subsequent papers in this series will address how education through the Center is experienced by Indigenous and non-Indigenous MSW students, and participants' perceptions of outcomes of educational and systems change efforts, and their advice to others seeking to strengthen culturally responsive child welfare practice. Consistent with a holistic perspective of Indigenous social work and cultural developmental psychology, we approach these questions through ethnographic methods. In the current research, relevant concepts of education, collaboration, child maltreatment, and effective helping are sufficiently complex that they are unlikely to be fully understood by investigating isolated variables, especially those primarily identified by cultural outsiders. In addition, an important function of an ethnographic approach is to help us to identify our own cultural blind spots. For example, in Western-centered social work, so that they do not become obstacles to services and designing appropriate policies for culturally diverse communities. Everyone has cultural blind spots, which are those unexamined, taken for granted beliefs and practices within our own families and communities that seem natural and correct. When we, as community members, accept particular beliefs and practices, then those beliefs and practices become both known and invisible. Miller and Cho refer to this as the paradox of familiarity. Attention to diverse cultural cases is necessary to expose cultural blind spots in our understandings and render the familiar strange. Our experiences suggest that we can design understandings that are most adequate and policies and programs and practices that are more effective by learning from one another, Indigenous and non-Indigenous educators, practitioners, and scholars. The center is located in the northern third of the state in an area surrounded by Anishinaabe communities. The 2010 U.S. Census listed the Indigenous population of Minnesota as 1.1%, or around 60,000 people, of the state population. This is 11% higher than the national average of 0.09%. In Minnesota, there are 11 sovereign tribal nations. The 4 Dakota tribes are the Upper Sioux Dakota Community, Shakopee Mdewakanton Sioux Dakota Community, Prairie Island Indian Community, and the Lower Sioux Indian Community. These Dakota nations are the original inhabitants of the Minnesota area and are currently spread throughout the lower half of the state along the Mississippi and Minnesota rivers. There are also 7 Ojibwe bands, including the Bois Forte Band of Chippewa, Fond du Lac Reservation, Grand Portage Band of Chippewa Indians, Leech Lake Band of Ojibwe, Mille Lacs Band of Ojibwe, Red Lake Band of Chippewa Indians, and White Earth Reservation. These tribes are spread throughout the northern half of the state, many on large lakes, such as Lake Superior, Upper and Lower Red Lake, Lake Mille Lacs, Leech Lake, and Lake Vermilion. In addition, many of the state's urban centers in Minneapolis, St. Paul, and Duluth have Indigenous families and communities from tribes centered in the Dakotas, Wisconsin, and Canada. Participant interviews included 13 individuals with diverse roles and extended relationships with the center. They are tribal elders, center administrators, educators, researchers, Indigenous and non-Indigenous former MSW students, and a judge presiding over the ICWA court. Some participants have had multiple relationships with the center over a period of years. Center staff nominated them as knowledgeable about the center's history and work, and all nominated individuals participated. Please note that with the exception of Professor Priscilla Day, all participant names are pseudonyms to protect their confidentiality. Members of this research team have diverse professional and life experiences that enrich and strengthen the credibility of this ethnography. Our methods include a deliberate integration of insider and outsider perspective. Outsider perspectives are critical for identifying constructs taken for granted by insiders. Insider cultural knowledge and experiences provide a necessary context for identifying appropriate research questions, crafting culturally appropriate methods and procedures, gaining access to and establishing rapport with participants, and understanding their responses. Team members of Ojibwe, Oneida, and Mohawk heritage provided Indigenous perspectives. Team members also have decades of insider experiences in child welfare education and training child welfare professionals in working with Indigenous communities. They also have practice as child welfare workers, ICWA supervisors, and mental health clinicians. Several team members have held major roles within the center. We conducted 13 in-depth, semi-structured audio-recorded interviews lasting from 1 to 2 hours. The interviews were conducted at sites chosen by the participants and included their places of employment. All interviews were conducted by an Indigenous and non-Indigenous researcher, with the Indigenous researcher typically taking the lead. Participants were invited to tell their own stories regarding their involvement with the center. Follow-up prompts included questions about the center's cultural and spiritual roots, ways of working with stakeholders, including adversarial ones, and relationships forms and lessons learned from center involvement and how those affect their current work. Following the transcriptions of their interviews, participants were invited to edit transcriptions to best reflect their thoughts and communicate any additional ideas. We also conducted participant observations during 2 of the center's premier continuing education events, the Winter and Summer Institutes on Indigenous Child Welfare. The day-long Winter Institute is designed for all interested child welfare workers. The 3-day-long Summer Institute is for Indigenous child welfare workers and invited guests. In addition, we traveled to a tribal college, a private college, and a county social services center where former MSW students are employed. And we also traveled and visited with the center at the UMD campus. We described participant observation in loosely structured field notes describing physical setting, activities, social interactions, and our impressions. We also conducted document review. Center staff identified a variety of documents to supplement interviews and observations, including a series of booklets published by the center on raising healthy American Indian children, educational materials used in continuing education trainings, and the center's website. We collected additional supplementary materials during participant observations, including tribal college publications and documents from the Winter and Summer Institutes. These interviews were transcribed verbatim, and paralinguistic cues affecting meaning, such as joyful or reserved tone, or intensity of emotion, such as crying, were systematically noted. Indigenous and non-Indigenous university-based members of the research team read and reread transcripts to develop a preliminary conceptual framework describing participants' perspectives. Documents and field notes were used to triangulate, contextualize, and interpret interviews. A coding system was finalized through discussion with center-based members of the research team. University-based team members then applied this coding system to interview transcripts, resolving any disagreements through discussion. Before considering implications, it is important to acknowledge limitations. Due to the relative brevity of the participant observation, our articulation of the center's Indigenous educational worldview relied primarily on those aspects of which insiders were consciously aware and able to articulate. In other words, the outsiders on the research team had relatively limited opportunities to identify and raise questions about beliefs and practices that may have been taken for granted by insiders. In addition, the scope of this ethnography is limited. We recognize that there are multiple complex Indigenous cultures that vary from one another and additionally encompass variations within each culture. This ethnography focused on the center, which is influenced largely by the Anishinaabe worldviews of northern Minnesota. In addition, we recognize that within group variation is essential for a fuller understanding of cultural context, but such variation was beyond the scope of our study. We focused on beliefs and practices shared across participants. We also understand that education, while foundational, is not sufficient to bring about change to child welfare systems in the face of limited resources and political opposition. Strengthening tribal capacity, developing collaborations between tribal communities and county state child welfare systems, and removing system barriers to effective child welfare practices are other areas addressed by the Center that will be addressed in our subsequent papers. Thank you for joining us today. This is the end of Module 2. Please join us for Module 3.